Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry educators. With continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry educators who share their knowledge and expertise on topics not only for class discussion, but career success. Today's educator is Adrienne Asta, who began her massage career in 2001. She's the current president of the Massage Therapy Foundation and chair of the Community Service Grants Review. Additionally, she serves on the foundation's Development and Marketing Committee. Adrienne's an NCBTMB-approved educator, certified in neuromuscular therapy and prenatal massage. Adrienne is a past presenter of several important topics for EduTalks, which can be found on biotone.com under the EduTalk tab in the archive library. So be sure to take a visit there and look at some of her past topics. Today, let's listen and learn as Adrienne discusses the role of massage therapy in supporting heart health by exploring research showing massage therapy may help heart disease by reducing blood pressure, improving heart rate, variability, and relieving stress. Adrienne will discuss how massage aids in post-operative recovery for heart patients, reducing pain, anxiety, while supporting overall cardiovascular health as a non-pharmaceutical option to improve the quality of life. Thank you again for joining us. Please have sound off and video off, and feel free to chat questions during the presentation, which Adrienne will answer at the end. And with that, I know you have a lot to cover, so I'll turn the screen over to you and join you at the end for chats. Thank you again, everyone. And thank you, Adrienne, for presenting. It's all yours.
Thank you, Donnell. You did such a great job summarizing up front. And, as a fan of somebody who likes to, distill the information down, I think you did a fantastic job and made my job really easy, actually. So I'm going to just pull up our PowerPoint here so that you can see my slides. All right. So today we're talking about the role of massage therapy in supporting heart health. So when we connect with our heart, and I want you to put your hand over your heart and connect with your heart. What are some of the things that we think of when we think of our heart, right? So, before we even start that, I'll tell you what I think when I think of my heart is Biotone. So, not only does Biotone put on a great series like this for all of us who are practicing just to make us better practitioners in the treatment room. They also have consistently for the past 20 years, I think it's over 20 years at this point, have sponsored 2 of our community service projects. So the Massage Therapy Foundation has a community service arm to it where we grant we grant up to 4 projects, sometimes 7 with special funds for people who could benefit from our work, but that they don't necessarily have access to it. And because of Biotone support, consistently every year for the past over 2 decades, we have been able to fund projects to people who wouldn't otherwise have access. And to me, that is the true spirit of giving. And you're positively affecting people who otherwise they can't thank you directly. So to me, that's true giving, and that warms my heart. And we're talking about heart health today, and something as simple as donating to community service. Yeah, that's something that we could easily do for our heart health. Thank you, Biotone. Thank you, Jean and Ceci and your whole team. So the resources I referenced here for this talk today is, of course, the International Journal of Therapeutic Massage and Bodywork. So this is my go-to, ijtmb.org. It's free for all of us, not only in the profession, but anyone who is interested. And this is thanks to the Massage Therapy Foundation and the Registered Massage Therapist of British Columbia, and from our donations that come in. So if anybody on here has donated to the Massage Therapy Foundation, we thank you as well. We are able to give um, uh, a pathway for authors who want to research the effects of massage. This is the only scientific journal, peer-reviewed, PubMed Central indexed. It's fully online, full article, doesn't cost us anything, and in the spirit of open access, doesn't cost our authors anything to publish. So this is the journal that I go to first when I want to look up something if I'm unsure or what's the latest. ijtmb.org, and I just type the subject matter in the search bar and come up with a whole slew of things. I've also referenced PubMed Central, which is a resource through the NIH. And I found some really cool stuff with the Journal of Bodywork and Movement Therapies. ResearchGate and Google Scholar were also some areas that I poked around in order to find some support for today. So what do we mean by heart? And I want to special thanks to Helen Smith from the Massage Therapy Foundation. She's our digital marketing manager, and she put a little album cover down there of the band Heart, which is an excellent band. Thank you, Helen, for doing that. So what do we mean by heart? So certainly we think of heart rate, right? Like how the heart beats. And the heart rate variability is how the heart recovers, right? So how can we optimize with our work, how can we optimize healthy heart? We think of the actual heart, the actual organ, and you know, how does our role as massage therapists play into heart disease? And of course, heart as a feeling and heart as compassion and tenderness and care. And I think this is a really special piece of what we do in our profession. It differentiates us from a lot of other work that is geared toward helping people with the best heart health that they can have. So our overall role in cardiovascular health, you know, there's no doubt, I think, without even looking on any studies or anything like that, if you ask any common person on the street, why do people get massage? Mostly their answer is going to be to reduce stress. And, you know, stress, man, stress is it's that silent killer, right? We don't necessarily feel the physical effects of the emotional stress immediately, but we know as stress compounds, that you know, what happens to our heart rate? It goes up, right? So we have stress hormones circulating the body, and just kind of this general anxiety that might come from that. So reduction of stress isn't, even though that's kind of the first thing we learn in massage school, right? Usually it's that wellness massage will recover the whole body. We are the only profession who touches all of the dermatomes, meaning all of the places where each of the spinal nerve roots supply. We are the only profession that can do that in one session. And it's really helpful for somebody to take inventory of where their body is at, especially in stress situations, because we tend to be more up in our head with stressful situations than in our body. And we think of all of the stress pieces that come with you know, all of the physiological pieces that come with stress, right? We have an increased heart rate, our blood pressure goes up. Our breath rate goes up, our digestion goes down, our reproduction goes down, right? So um, lots of effects of stress that are easily reduced through our work. I think people would say, yeah, like it will help me perform better, right? So massage can help me perform better. If I can recover from exercise and makes my heart rate variability stronger, and it or more efficient, I should say, and um, we are able to then continue to move our body. So there's no doubt that our ability to move will sustain our longevity. So our movement is crucial. It's a quality of life. When we stop moving, we stop living. So the ability for us to reduce pain, even if it's musculoskeletal pain, we are looking at an easier return to activity. And remember, we don't need to be professional sports massage therapists. We don't need our clients to be flipping tires in order to have good cardiovascular health. They just need to move their body. And with the work that we do, not only are we physically able to make the soft tissues more pliable, but we can also encourage them, right? You're doing great. You're on the right path. Hey, I'm your partner in this journey, and I can help you, through the work that I do. It can help get you to any wellness goals that you'll have, and the heart's at the center of that. Portia Resnick, who is one of the Massage Therapy Foundation Board of Trustees. She's a trustee on our board, had done a heart rate variability study, case report about 10 years ago. And she was able to show us that while, resting and massage um, resulted in the same outcome, brought the heart rate down. Massage did so right away. There was a far faster recovery with massage than without massage. So we can see that if we have a client who's super active, using massage to help be part of their routine is great. But we're also looking at the ability for us to think about it not for massage being not just for the super active, but to just keep somebody in motion. So if we think about just keeping in motion, we are thumbs up for cardiovascular health. So this quote was from the Bodywork Movement Therapies journal. Massage caused an immediate parasympathetic activation during recovery from a single exhaustive muscle contraction exercise. So muscles contracting to failure, that might be a term that's familiar to those of you who are in a strength capacity as well as massage. We know that the work that we do can help recover those muscles faster and get ready for the next layer of work. All right, and think of the heart as an actual organ. Well, I am super excited at this time regarding our role in an integrative healthcare team, and some of the things that I have read recently and in the past have showed us that we really have a significant role to play in an integrative healthcare team. So massage therapy has significantly reduced postoperative pain and anxiety in patients undergoing open heart surgery. So I found this article, this research article through the American Heart Association. They have a journal called Circulation. Now Circulation would not be a journal that was in my purview. I do not have the time to read Circulation magazine, especially because it's a weekly journal, right? So it's peer reviewed. But I found this journal on PubMed. So I did a search on PubMed and came up with the article on post-operative pain. I remembered reading an article in the past, and I felt like it was a long time ago. And it was when I looked back in my notes, it was from 2012 when I read that other article about massage therapy being good for patients who had just undergone open heart surgery. And I wanted to see if there was any update. And not only was I happy about the level of research that this was, but I was also thrilled that there was no doubt in anyone's mind, and the audience for this particular journal are cardiologists, cardiac surgeons, cardiac nurses. So we are looking at a significance that was so high that it is undoubtedly a good idea for us to be able to care for these patients. So this is when we send you the when we send you the handout, we have the footnotes down there. Please look at it yourself. Use it as a tool to talk to your not only your doctors, etc., but your patients who might have family or friends, or maybe they themselves have to unfortunately go under the surgery. Massage can be really beneficial. The amount of sleep that has been reported for a post-operative cardiac open heart surgery patient, it was pretty astounding. And I'm hoping that we can be a little bit more forthright with how we speak to our allied health professions and our doctors if we have access to them. It's really important that we give this care. The reduction in anxiety is also helpful to keep their stress levels down, because we know that in that parasympathetic state is where the healing happens. So if somebody has an elevated anxiety, not only is their pain elevated, but we also have a slower return to recovery from that surgery. So we can do a world of good as part of this healthcare team. And here's the quote I pulled from there. So massage therapy represents a valuable complementary approach to traditional care methods. So I love that they use complementary. I think we are on the right track. The Massage Therapy Foundation has funded other studies that are looking at the integration model, and I encourage you to go to massagetherapyfoundation.org to take a look at those particular articles. All right, and a special look at heart pain. So early in my career, I worked at a local health center, gym of sorts, and racket club. And I had a client come to me, and he was complaining about pain that went into his chest and into his back and down his arm. And it was, there was some tingling, and it was numb, and he was short of breath. And he said that he had been to the neurologist, and the neurologist said there was nothing wrong. And he had been to his cardiologist. The cardiologist had said, you know what? You don't have anything wrong with you. They ran all kinds of tests. And I used to be so afraid of that, because they're the doctor, right? The doctor should know what's happening. But if we look at that, if we look at the symptoms of that and the steps that this particular client took, essentially he has ruled out every major contraindication that would prevent us from doing the work with him. And as you all probably know on this call, that those were eventually symptoms of thoracic outlet syndrome. But we also have, aside from any occlusion of a neurovascular bundle, we also have muscles that refer pain into the areas, into the chest, down the arm, into the jaw, even into the abdomen, making you feel nauseous. So these are muscles to look at if the client has arm, hand, chest pain. I included only a few here. This is this one right here is serratus posterior superior. Here is scalenes. You can see into the chest, into the back, down the arm, into the hand. Can you imagine if that was on the left side of the body? Right. And as we know, those scalenes attach to the upper ribs, right? As ribs 1 and 2. So we have this hyperventilating of sorts, this shallow breathing, this panic breathing that may stress those muscles more, which may shoot that pain further down into the chest and down the arm. So we're looking at a really delicate balance of, how can I address these muscles that are under duress while at the same time calming down the client and knowing that they're in good, competent, educated hands. So brush up on that muscle work too. It is an important part of what we do, especially when we're looking at heart pain. All right, and here's a special look at heartache. Okay, there's heart pain and there's heartache, and I think an overlooked component of what we do is being of loving presence to someone, right, while they're on the table. So, certainly it feels good to sit in a massage chair and, get a massage from the pressure chair, right? For anybody who may have been at School Summit, we had the vibrating plates, which felt amazing, right? It felt so good. We have the little massage guns and our foam rollers, but we're more than this being that applies pressure. And it's far more than just like, okay, I'm a human, so I can respond to your to the tissue change. We're looking at an opportunity for us to show people their worth. And to me, that is a benefit that not many other professions get to do. Our heart hurts when we are alone. Our heart hurts when we feel isolated. We see a big push right now for the kind of collaboration between massage therapy and mental health practices as well. It is an exciting time for massage and a really, really good opportunity for us to collaborate with the social workers in our communities, and for facilities who treat patients with depressive disorders. And we're not just talking about depression in and of itself. Depression is a co-condition of a lot of other pathologies that we see. Not only are we looking at anxiety, psychiatric disorders like anxiety and substance use, eating disorders and things like that. Think about our chronic pain clients, right? So they have fibromyalgia or chronic fatigue syndrome that has those tender points that are just so exhaustive. We have degenerative diseases like MS and Parkinson's, Lou Gehrig's disease, right? ALS, that have a decline that makes people lose their faculties. And that's a depressive thing, especially to happen quickly. So not only are we looking at diseases that have a decline, and we also we're looking at diseases that are we wouldn't think of diabetes as having a depression component to it, but it's a lifestyle change, and it's hard to when you're having a hard time regulating your blood sugar and the damage that gets done to the blood vessels, and then eventually because diabetes is damaging from the periphery towards the center, So eventually we're looking at, cold hands and feet with ulcers and things like that. And those are, it's hard to live with. So don't overlook the depression factors that come with the other things that we treat. And efforts from our mental health and allied professions are seriously studying how to integrate this. So keep doing what you're doing. It's like all sessions, massage is the best when we are tailoring each session to our clients. Being informed, being up to date with tools like the IJTMB can, they might change the way that maybe you provide care, and maybe it won't change your technique immensely, but it certainly can help your client feel confident about the work that you're doing, because that they know that you're curious and they know that you're always looking to be the best therapist you can be for them. And working in conjunction with other healthcare providers can really show our clients that they are number one in our book. So one of the tools and the resources that we are able to provide you is this. Every third year, we have the International Massage Therapy Research Conference. This year, it's April 27th to the 29th in Alexandria, Virginia. We can register. It is continuing education continuing education hours to be earned. And we are going to hear some studies that are in process, and we're going to hear some results, some preliminary results from some studies that are specific to working with trauma-informed care and matters of the heart, such as that. So I think that is all for today. Oh, wait. Oh, nope. Let me show you some resources. So I want to bring to your attention, speaking of heart, I want to bring to your attention our community service resources here. So if there is a project in your area with a nonprofit that is serving underserved communities, and we want to add massage therapy to a part of the services that they give, encourage that organization to apply for a community service grant. And please know that resources like MassageNet help us create a community where we get to talk with not only other massage therapists, but also researchers in our area about what really happens in the treatment room. So feel free to go to massagetherapyfoundation.org in order to find all of the tools that are available to you for free to make your practice better. Again, a special thank you to Biotone, over 2 decades of supporting that community service. So big heart space for you, Biotone. I really appreciate you, especially as the chairperson of the Community Service Grant Review Committee. It is without a doubt doesn't go unnoticed. So thank you so much.
Well, thank you, Adrienne. And everyone, feel free to chat questions or comments for Adrienne to address. And Adrienne, have with that one diagram that you showed about the scalenes and everything like that, and they'd been to the doctor, not, it seemed like a point of concern with the doctor. Everything seemed
Sure.
good with their hearts, but they're experiencing the pain. I
Yeah.
mean, how did you approach, did you treat that person? And is it is it more circulation type massage I mean, how
So
did you approach that?
I personally did some trigger point work on this client, and one of the just to backtrack a little bit, give you a little bit of backstory from that is, I like Ruth Werner would say, back when I was in massage school, right? Like 2 decades ago, two plus decades ago, the pain management approach to body work was very like here's the point, press it, like here's the sit there and take it, right, kind of thing. Like I'm going to apply this pressure to you, and then eventually you'll feel better. And there wasn't a whole bunch of space to look at that time. It's different now, but at that time, there wasn't a whole bunch of space to look at, like maybe they just need to just turn the dial down just a little bit. Maybe it's not that they're looking to be pain-free. I don't want to get rid of like all of it. And I personally don't like the approach of, kind of working really hard in order to get the pain out. Inducing pain to relieve pain sounds like, fighting for peace, to me. So I knew what I knew about the pain referral patterns from the muscles, and I worked very lightly to start, just to see. And I think what happens in a circumstance like that, and it is not common, I don't think this is different for most people on this call, is that as soon as somebody can connect, like, oh, that's the pain that I'm feeling, right? I touch an area that replicates that pain pattern, and then they get connected to it. Okay, that's it. Then they start making that connection with their body, and then they trust you more, right? You're building trust with that particular client. So I did trigger point work. I hate the names of the modalities, and I can come back and talk and rant about that at another time. But I did trigger point work, and I was able to still be nurturing and gentle doing the work. And then as the tissue warmed up, as the therapeutic relationship kind of grew a little bit deeper, then there's more trust. More trust means they can relax more. Their stress levels come down, and then we're working together. Especially the work I do involves the client participating in the work as well. So there's a sense of control, which also brings the stress level down. Again, good for your heart, right? So that's a great question, Danelle. It's really, it's one where we're like, do I proceed or not? And just high levels of communication. And, talking to that client about outcomes was, I had said, you could feel worse tomorrow. It's possible that you'll feel worse tomorrow. It's possible that you'll be swollen. I hope not, but you never know. And I told that particular client, it is okay if you're worse. I need to know that. It's just information. Like, you are not hurting my feelings if it didn't work or if you feel worse. And, you're not going to get in trouble. Like, nothing like that is going to happen, but it informs the next move. So all of that has nothing to do with how I touch that muscle, right? Be in communication. How does this feel? Can we go deeper? Do we want to wait? Should I back off? Right. Most of those things. Here's what's going to happen after. Call me if this. Let me know these pieces. Those are all pieces that make the client feel far more comfortable with your work without you actually applying your hands onto them.
Now, being part of let's say a healthcare team, is it a value for therapists to speak to cardiologists about complementary treatment?
It's hard to talk to them, right? Because they're so busy. I tried when I read the 2012 article, I wrote a letter to every cardiologist in my region. It's like, hey, I'm qualified in these ways. And of course I got zero response, right? Like, nobody replied to anything. It was probably just, I don't even know if it even got opened. So I don't know if that's a successful path right away. You might have to find somebody who's adjacent to the cardiologist, whether it is their nurse practitioner, or maybe maybe you have a client who has a cardiologist that they can advocate for you because they have the cardiologist attention. And it seems easy to say it that way, like, oh yeah, just talk to your client who has the cardiologist and give them the information, because that's not going to go super far either, probably. It's just being persistent, just believing that like I have the information, I can be helpful, and ask the right questions. Who do you know? Do we know anybody in our community who could connect me with someone where I can show them this benefit? I'm sure you will. If you keep asking, you will find that person to get the in to where you need to be. And all you need to do is get one person's attention. It has been my experience through the arc of my career that is if you get one person's attention, you're going to get others' attention, and that doctors are far more when they're not busy, they're far more receptive, right? So the key is just to keep persisting so that they get the message. You don't also have to break the barrier of like, oh, this person just think I'm just a massage therapist, right? They'll hear it and they'll see it, especially if you give them the backup in their journals that they're reading, right? Or that they should be.
Right. Now, through the Massage Therapy Foundation and the research that you had mentioned at the beginning, is there literature that therapists can print off and on heart health or massage and heart health that they could have for, in their office,
Yeah.
in their practice area for um, promoting that,
Yeah.
promoting,
Mhm. Not many of our clients wait very long at my practice, but there is a binder of, massage and heart health, massage and knee pain, massage. And so if somebody's waiting, they could just, kind of take a look at that. And then if there's somebody who's that has that level of interest, you can always send them a copy of that. So yeah, printing off is easy. Pretty much every website I've listed in the references has a PDF version for you to be able to download. Um, Almost all of them are open access, so you'll get the full article. I think there might have been one or two that had a paywall on it. You just don't use those.
right. The
They're not as good
information's
anyway.
there.
Just kidding.
And then just I wanted to circle back to diabetes and I'm not sure if you tied in the depression with the diabetes, but
Yeah.
uh, your clients that come in that are diabetic, uh, do you address the heart issue with them?
Yeah, it's I address it in a way um because it's more vascular than it is heart, just because of the way that the disease progresses, which is from the periphery towards the center. If your client's a smoker, now we have a smoking diabetic. Now we have a really bad combo, right? Because now we have the cardiovascular damage that's happening from the center and radiating out, and then we have diabetes that, even though it's of pancreatic origin, it's still a vascular consequence. So then the vascularity then puts some stress on the heart, because the heart has to work harder to try to pump it out to the periphery. So yeah, we're going to see the damage and the vascularity before the heart, but then eventually the heart will catch up.
Okay, okay. And
Mhm.
depression in general
Yeah.
puts a strain on the heart.
For sure. Yeah. So depression, even though when we think of, anxiety tends to spark the image of that kind of high heart rate, right? Kind of all the time. But depression on the psyche is really like a sadness is really hard on the heart, just, not just emotionally. I think in the article I quoted from the University of Massachusetts, So that was a doctoral dissertation from a nursing student who was getting their PhD, and she did a meta-analysis of all of the articles so far that had talked about massage therapy's role in managing depression. And in that article, in that dissertation or abstract, they have links to the cardiovascular benefit of not being depressed, essentially. So I think I looked on PubMed. It was a PubMed. It might have been Google Scholar. And I just looked at this year, 2025, massage therapy and depression. And it was thousands of articles came up because depression's not just it's not just a comorbidity, right? We have depression as its own set of pathology. And then we also have, if they had they had a whole bunch of pediatric articles as well. So there's plenty, and it's right at our fingertips. So don't be afraid to use it. You don't have to memorize the article. So this was something that had slowed me down a little bit when I was kind of dipping my toe into like how do I utilize research in my practice. It slowed me down because like I'll never be able to remember all the nuances of all of these things. But you don't need to remember it. You just need to know how to reference it, right? So remembering is for, for things that are a little bit more in our scope. But to be able to be a resource and provide our clients with information, they'll make the changes that they need to if they're informed the right way, and we can be an ally in that. So yeah, I encourage you to look up, IJTMB, PubMed, and Google Scholar, my top three.
All right. Well, thank you for that. I haven't seen any questions or comments come in. So okay, Sally, this is such helpful work. Cardiac surgeons sometimes have programs for their patients such as diet recommendations. If you attend their meetings, it is a great way to mingle and talk about your work with them and their patients. I got 3 new clients last time I attended one of these. Thank you, Sally, for
Perfect
sharing that with
suggestion.
everyone.
That's a great suggestion.
Thank you. And Sally is also a past presenter of EduTalks, and she will have an EduTalk coming up in a couple of months
Excellent.
on breast health. So join us for that. Trisha has a comment. I don't see you though.
Is it okay if I say it out loud because I'm driving? I can't really
Yes, you
text.
can say it out loud.
Okay. It's Adrienne, right?
Correct.
Okay. You know how small cell phones are.
Yeah.
I just want to say this. I have been a body worker for a long time. I want to say this, but in the deepest respect. I mean this in the deepest respect. But what I've found is sometimes when clients will say to me things like, "Isn't that a mess?" or "Oh God, this is my bad leg," or whatever they're saying negatively, I have for 15 years made a correction to that, a fine tune. I might say, well, that's an area that wants to relax, or, yeah, let's get that stress out of there. I always make it into a positive. And so when I was hearing you just now referring to something being worse the next day, that word worse just feels kind of strong. And so I wondered if I could say, like, like when I'm doing craniosacral work on people and there's emotional work and they might be emotional the next day, I might say, well, if you find yourself a little grouchy, a little moody, don't be surprised. That's a good thing. But to say something's going to be worse, I wonder if it's better to say, well, there's going to be some inflammation. You may not feel good. Give me a call. Let's talk. Just leave it a little more open and not put the W word on it, because that's what doctors do. They like to diagnose, and then that's a final thing, and that's what they're stuck with, is that diagnosis.
Sure. Great idea. If the pain dial goes up, or if something feels not relieved or something. Yeah, it's a good idea. Good.
Thank you for
Thank
hearing me. I've noticed that word worst.
you. No
Thank you.
problem. You got it. Thank you.
Thank you, Tricia. I'd like to mention to everyone to please watch your inbox tomorrow. You'll receive a follow-up email. It will have a copy of this recording. It will have a copy of the PowerPoint presentation, and the resources are included there. And it will have Adrienne's contact information and contact information for the Massage Therapy Foundation. So if you do not see it in your inbox by early afternoon, please check your spam or junk folder. And at the very last, feel free to email me and I will send that off to you. Additionally, I'd like to mention our upcoming EduTalks, and that will be March 4th. We will have Dr. Susan Salvo presenting pregnancy massage, circumstances, risks, postpartum, and holistic supports. And Susan, as well as a past presenter of EduTalks, again, found in the archive library on biotone.com. Our EduTalk Diabetes series is something that we also do for you, those of you who have not attended an EduTalk Diabetes series or are aware of it. On March 11th, we'll have Linda Lockett-Brown presenting on using fiber to decrease blood sugar levels. And the EduTalk Diabetes series are also posted in the archive library. And Linda, again, is a past presenter as well, so you'll find her talks there. March 18th, we have a new presenter, Peggy Lamb, and she'll be presenting on 5 pathways to become an abundant body worker. So we have a great lineup for the month of March. Thank you so much for joining us tonight. Adrienne, before I close out, do you have anything in closing that you'd like to share with folks?
Please use the Massage Therapy Foundation's resources. They are abundant and free. And I can stay on for a little bit if anybody has a question.
Okay, and MTREX?
So MTRIC, International Massage Therapy Research Conference. You can get 16 continuing education hours at the conference. It's really inexpensive for the amount of knowledge that you're going to get from this. It's in Alexandria, Virginia, April 27th to 29th. I will be there. I hope to see you there. Come say hello.
That will be great. And I don't see any other comments coming in. And
thank you
again,
so much, Biotone. Thank you.
And quickly before we go, because I am a big supporter of MassageNet, can you explain that to folks and how they can participate?
Sure. MassageNet.org. MassageNet is our practice-based research network. It is the opportunity for us to be selected to do massage in research studies by doing what we do in the environment that we do it. So no extra skill set is necessary. And it is free to join the database, and there is no obligation for joining the database. You have to opt into a study, but putting your info into that database helps you to be reached out to when there is one.
Well, thank you. And okay, and Marla just posted the link to that as well. I will include those in the follow-up as well. And again, thank you everyone for all you do for the massage industry and participating in EduTalks. And join us March 4th. The RSVP opens tomorrow for Dr. Susan Salvo's presentation on pregnancy massage. Thank you so much. And thank you, Marla. Thank you, Adrienne.
Thank you, Biotone.
And thank you, Biotone, of course. Please join us again and be safe. Take care, everyone. Bye-bye.